So hi, Leanna, and I thought I saw Eldon and Brandy has arrived. Yeah, and is anybody else sitting with you when you sign in, if there's other people joining you, so that we know who else on the call. So today we're going to talk about pediatrics. And what is pediatrics? It's a branch of medicine that cares for newborns, infants, children, and adolescents. They are a population that has special needs. And as a medical assistant, you need to be knowledgeable about the growth and development phases. You need to gain the confidence of the child, and when you do that, you gain the confidence of the parents too, and vice versa, and help reduce anxiety and fear. So some of your responsibilities would be the same as with an adult: taking a history, assessment, vital signs, including height, weight, and vision, and hearing, laboratory work, injections, observing parent-child interactions, and noting the child's development level. So immunizations are important to keep kids from getting diseases that can be prevented. And also, if they have immunizations, they can't spread the disease to others. So those are two good reasons. So vaccines stimulate the immune system to produce antibodies against pathogens. They're given either by mouth, injection, or intranasal spray. And you will need to learn how to do the preparation of vaccines. You need to follow the manufacturer's guidelines, but this is where your mentor can really help teach you how to reconstitute the vaccines appropriately and the different dosages for different ages. It's important to note allergies so that you're not giving injections to children who are allergic to something contained in the immunization or the vaccine. And then also knowing the symptoms, the side effects, the contradictions, and the allergies, so you can educate the parents on the side effects and what to watch for, and even a little bit how to treat those side effects. And if a child is sick or has a fever, then you might need to postpone the immunization, and the provider would make that call unless they've given you instruction on how to make that assessment. So preparation of vaccines for administration. You need to document any adverse side effects. You're responsible to document the immunization that you gave, where you gave it, the date, you know, what. I think sometimes don't you even have to write down the lot number on the vaccine, and then make sure that the parents have the information that they need. Some vaccines require repeated doses, and you can only administer compatible vaccines at any one visit, so you need to know what those are. They need to be administered according to a schedule to ensure complete vaccination by 15 to 18 months. And you're in your pharmacy room or where you keep your vaccines, on the wall you should have a vaccination schedule for the different ages of the child and what vaccines can be given at those ages. And trying to stick to that schedule is rather important, because then they'll complete their vaccination in time and they'll be protected when they should be protected from those different diseases. Booster vaccines on school entry, and again every 10 years, should occur throughout adult life. And then if kids do get behind, there is a catch-up schedule, and that I would talk with your provider about what that would look like for in particular cases. So I think you would need to, you know, it would be case by case. It wouldn't be just something that standard that you would do. You would do it case by case. So when you're giving vaccinations, you need to use all the infection control precautions like hand washing, gloving, sterile needles, inspect the vaccine, make sure it has, you know, that it's not been contaminated, reconstituted appropriately. You can pre-fill your syringes, but be sure you label them so you know what's in them. And then you can give multiple vaccinations at a time, and I'm sure that you've seen that. It's kind of like double teaming those poor kids, but in the end it's probably less stressful for them. The needle gauge is 22 to 25, and the length for newborns is 5/8 of an inch, and for children it's 1 to 1 1/4 inches, and in adolescents you go by weight. And then there's different injection sites, and you would need to talk to your provider about what injection sites you're going to use. And then the technique also, that's something that you need to be learning on the job, and you know, working with your mentor on perfecting that technique. And then in your book there is an injection guide. So you need to be able to hold infants and toddlers in a way so that they can't move around. You need to make sure the parent understands how you're going to administer the injections so they don't freak out on you. The deltoid is the preferred site for children 2 to 4 years old. Toddlers, especially so the first immunization, the kids don't have a clue, but then after that they kind of know. So they'll likely be anxious when they know enough to be anxious about it. But you would need to remain calm and very deliberate and just no nonsense, let's get this done and just let's do it. Adverse reactions. Most commonly the reactions are local, so redness, swelling, and then there can be systemic or allergic reactions as well. There can be fainting, especially in older children who work themselves up. Vaccine safety. It's the same as for any injection. A CDC study in 2013 showed that vaccines do not cause autism spectrum disorder. Preservatives have been used in vaccines for 70 years, and so these are good things to know to tell your patient. So now we're going to, the next portion of today is about human development. And so we're going to watch this video on Erikson's psychosocial theory of human development, just to kind of give you some ballpark thinking for where kids should be at certain ages. And then let us know if you can't hear this, because I'm not sure if we have the sound. I guess if you've been hearing me, it should be.
And I did Erikson's psychosocial theory of human development. Erikson's theory is based on how personality is developed through stages in life. Three major elements that make up Erikson's theory include ego identity, ego strength, and conflict. Ego identity is developed by human interaction and how an individual becomes more conscious of themselves and their surroundings. Ego strength deals with an individual becoming competent in different areas in life. By becoming competent in life, they feel more important. Erikson believed everyone at some point or another will go through a conflict in their lives, which causes a turning point in their development. In this time, personal growth is high, but potential for failure is equally as high. Here is a diagram briefly explaining each stage. It shows the age group and what conflict counters it. Each stage focuses on a different crisis relative to the age group, which prepares them for the next stage, in which they have a completely different conflict to overcome. As the arrow shows, each stage increases in complexity. Stage 1 of Erikson's psychosocial theory deals with the age between birth and a year and a half. During this stage, the major conflict is trust versus mistrust. At this stage, the child is completely dependent on their caregivers. The child learns trust by being given the necessary needs to both live physically and emotionally. Stage 2 of Erikson's psychosocial theory deals with children ages 1.5 to 3. The major conflict during this stage is autonomy versus shame. This stage, children are becoming more independent and learning things on their own. It is in the parents' reactions to their children's actions that develop this part of their personalities. The parents need to be patient and encouraging in order for their child to develop properly in this stage. Stage 3 of Erikson's theory deals with ages 3 to 6. The major conflict in this stage is initiative versus guilt. This is considered the play age for children, where their imaginations grow. They begin to mimic and mirror what they see. They also learn morality. When they do something wrong, they can now expect a punishment. This is how they are taught guilt. Stage 4 of Erikson's theory deals with ages 6 to 12. The major conflict at this stage is industry versus inferiority. This is the age where children spend more time with their peers and teachers than with their parents. This causes them to have a much bigger influence on them. This is considered their entrance to life, where they are becoming very independent. They become inferior in this stage if they do not succeed socially. Stage 5 of Erikson's theory deals with the ages 12 to 18. The major conflict of this stage is identity versus role confusion. In this stage, people pull away from the influence of their peers and teachers and start determining their own identities. This is when people go through puberty, so there is a large change at this point in their lives as well. Stage 6 deals with ages 18 to 35. The major conflict at this stage is intimacy versus isolation. During this time, a person begins to settle and want to start a family. Oftentimes, failing to find a romantic partner at this stage causes people to have isolation from others. Stage 7 deals with ages 35 to 55. The major conflict in this stage is generativity versus self-absorption. In this stage, the two biggest responsibilities to a person are their career and their children. Stage 8 deals with ages 55 to death. The major conflict of this stage is integrity versus despair. This stage is about life reflection. And that's the end. Thank you all for listening. Here are my sources. Thank you.
Okay. So that was a crash course. Okay, where's our slideshow? Right. So these are just, that's one theory of human development. There's 8 or 9 different theories. Each theory focuses on different aspects. In your book, Table 26.3 has a pediatric growth and development chart. So there's a lot of handouts and things that you can, and information that you can use with parents, and I think there's developmental graphs, and I'm sure you have all those things at your place of work that you use, that you've decided to use there. Just always remember to be caring, respectful, supportive, and non-judgmental as you're having these discussions with parents. So length and weight measurements, again, you have ways of documenting this to show whether they're in the percentile that they need to be in. So growth percentile charts. Growth charts help diagnose different abnormalities in growth or nutrition or disease, including some syndromes. Height and weight measuring devices in pediatrics are the infant platform scale with the measuring board incorporated into it, or you can just use a tape measure on a pad. Done it both ways. Head circumference is a common measurement in infancy. And measuring that will help make some diagnoses of brain disorders. And then measuring chest circumference if there's overdevelopment or underdevelopment of the chest organs like the heart or lung or the rib cartilage. Failure to thrive. It's a failure for an infant to maintain an established pattern of growth and development that responds to the provision of adequate nutritional and emotional needs. A thorough history will need to be taken. Sometimes you'll see these children more often to kind of make sure that they're getting the nutrition they need. They may have, there could be different causes. It could be organic or inorganic. It could be social or emotional. And most of these causes can be treated if found in time. And sometimes it's related to the nutrition that they're getting. Either the breast milk isn't adequate or the formula they're on, they're allergic to it, so there's different reasons why children don't thrive in the early years. So pediatric vital signs, the vital signs are the same as in adults for the most part, but we'll watch this short video.
This video demonstrates how to obtain pediatric vital signs. Equipment required includes the following: a digital, tympanic, or temporal thermometer, thermometer probe covers as required, a watch or clock with a second hand, a pediatric stethoscope, a sphygmomanometer with a pediatric-sized cuff, a pulse oximeter, biohazard bags. While these come in various colors, they can be identified by the universal biohazard symbol. Please check your institution and state regulations to confirm which bag is used. Alcohol swabs, gauze swabs, and the necessary documentation. To begin, wash and dry your hands. Assemble the equipment needed for the procedure. Clean the sensor and probe surface of the temporal thermometer using an alcohol swab. Apply a probe cover to the digital and tympanic thermometers. Clean the stethoscope diaphragm. Check that a watch or clock with a second hand is in sight. Ensure that the sphygmomanometer and cuff are in working order and of an appropriate size for the child. Check that the pulse oximeter is working and clean the finger probe with an alcohol swab. Confirm the child's details. Explain the procedures to the caregiver and the child in an appropriate manner. Address any concerns or questions. Obtain a brief history of any symptoms and obtain consent from the caregiver. Ask the caregiver to undress the child, leaving the undergarments on. Discuss how the caregiver can assist in the procedure. Position a young child on the caregiver's lap. An older child may sit on their own. Blot any visible perspiration and remove any obstructions, such as hair or headwear. Position the probe of the temporal thermometer in the center of the forehead and ensure that the probe is flush with the skin. Press and hold the scan button. Slide the probe across the patient's forehead, keeping it flat on the skin. When a measurement is reached, a light will flash and the thermometer will beep. Release the scan button and remove the probe from the skin. If there is perspiration on the forehead, lift the thermometer off the forehead with the button still depressed and place the sensor on the child's neck, just behind the earlobe. Read and record the reading from the digital display.
Okay, so so that's the temperature. I wanted you to see all the equipment that they had out. Obviously, you don't need all three types of thermometers. You just need one. So then taking the pulse, if the child is less than 5 years of age, take apical pulse, which is just listening to the heart rate with the stethoscope and count it. You should know the normal heart rate ranges for children, and note when you document it the rhythm and rate, just like you do with an adult, normal, bounding, or thready. For respirations, older children are measured in the same way as adults. If they're younger than 6, you can watch the rise and fall of the abdomen and count that. Movements are often irregular, so you need to count for a full minute instead of 15 or 30 seconds. And then normal respiratory rate varies with age. The blood pressure in young children is not usually taken unless the provider requests it. But if a child is 3 years of age or older, it's taken annually, unless it needs to be done more often. You can use electronic or aneroid equipment, but you need to make sure that the cuff size is appropriate. Usually in the upper arm, you would want 2/3 of the upper arm covered by the cuff and no more than that. Or you can also do a palpating systolic blood pressure, but in most cases you should be able to get both diastolic and systolic. Collecting urine from an infant, you need those collection bags that are sticky that you can put on them to catch urine. Or you might need to do direct urethral bladder catheterization. if you need a sterile specimen. And then screening infants for hearing impairment is done immediately after delivery. And then you may have in your clinic an automated system for checking hearing. And if not, for older children, especially children you think have a hearing problem, you can refer them to an audiologist. A lot of times hearing issues are noticed if there's a speech delay. You have to rule out the hearing problems in that case. Vision, you check newborns, their response to light to check vision. Older infants, they can follow objects up and down. And then kindergarten and older, you can use cards or charts. So there's a lot of common disorders and diseases in children, and this will be another crash course. This video just kind of, but it has a lot of good information. It throws it fast and furiously, but it's actually pretty good. It's for parents, but it just had that information done very concisely. I thought it'd be useful here.
Childhood illnesses every parent should know. While vaccines have made some childhood illnesses rare, many others still remain a fact of life. They range from common infections like croup to mysterious ailments like Kawasaki disease. In the following presentation, you'll learn the facts about 24 childhood illnesses, and we recommend that you always seek medical advice for proper diagnosis and treatment. Croup. The hallmark of croup is a tight cough that sounds like a barking seal. The cause of the cough is inflammation in the upper airways, usually due to a virus. If breathing becomes severely impaired, hospital treatment may be needed. However, most kids get better on their own in about a week. Croup is most common in toddlers. Bronchiolitis, or RSV. RSV stands for respiratory syncytial virus. When it affects the lungs, it causes bronchiolitis. It's most common in babies under 12 months old, and often occurs most between October and March. The infection begins with flu-like symptoms, including a fever, runny nose, and cough. Some young children with their first RSV infection will develop noticeable wheezing and may need treatment in hospital. RSV tends to be milder in older children and adults. Ear infections. Young children are prone to ear infections because of their small eustachian tubes. These tubes connect the ears to the throat, and they may get blocked when a cold causes inflammation. This traps fluid inside the middle ear, behind the eardrum, allowing germs to breed. The symptoms include fever, fussiness, and ear pulling. Most ear infections are due to viruses and go away on their own. Childhood vaccinations can help prevent infections from certain bacteria that can cause ear infections. Glue ear. Glue ear refers to a buildup of fluid in the middle ear, usually without any pain. The medical term for glue ear is otitis media with effusion, and it often follows an acute ear infection. The fluid usually clears up on its own. If it lingers and threatens to interfere with a child's hearing, grommets or ear tubes may be recommended to help the fluid drain. Hand, foot, and mouth disease. Hand, foot, and mouth disease causes a fever along with blisters on the inside of the mouth, the palms of the hands, the buttocks, and the soles of the feet. It's usually caused by Coxsackie A virus. Most cases are not serious and last a week to 10 days. Hand, foot, and mouth disease is not the same as foot and mouth disease, which affects farm animals. Conjunctivitis. Tears, redness, discomfort, discharge, and crusty eyelashes are all signs of conjunctivitis. Often caused by the same viruses as the common cold, Conjunctivitis spreads rapidly in schools and nurseries. Seek medical advice to determine whether your child needs treatment. Most cases clear up in 4 to 7 days. Slapped cheek. Slapped cheek syndrome, or Fifth disease, causes a bright red rash on a child's face. A rash may also appear on the torso, arms, or legs. The culprit is the parvovirus B19, a virus that may cause mild cold-like symptoms before the rash is even seen. Slapped cheek syndrome usually affects children aged between 3 and 15. Most cases develop during winter or early spring, and the symptoms usually disappear within a few days, but can last 4 to 5 weeks. Rotavirus. The National Health Service estimates that every child will have at least one rotavirus infection before they are 5 years old. The main symptoms are vomiting and watery diarrhea, which can make babies become dehydrated very quickly. It's more common in winter and spring. A rotavirus vaccine is currently available for babies, but is not part of the NHS childhood vaccination program. Kawasaki disease. Kawasaki disease is a very rare condition that mainly affects under 5s. Doctors have yet to discover what causes it. The symptoms include a fever, patchy rash, swelling, and redness of the hands and feet, as well as bloodshot eyes and chapped red lips. Without treatment, the illness can damage the heart and may be fatal. If you think your child has Kawasaki disease, seek urgent medical attention. Chickenpox. Chickenpox is usually a mild infection, but is a very infectious condition caused by the varicella zoster virus. Chickenpox is most common in children under 10 years old. It's most common in winter and spring, and chickenpox can cause dangerous complications in newborn babies, adults, and pregnant women. Once you've had chickenpox, it's extremely rare to catch it for a second time. A vaccine is available against chickenpox for some people in at-risk groups. Measles. If your children have had their MMR jabs, you probably don't have to worry about measles, although there are still some cases among unvaccinated children. The infection starts with a fever, runny nose, and cough. As these symptoms fade, a full body rash appears. Most children get better in 2 weeks, but some develop pneumonia or other problems. Mumps. Mumps is another childhood illness that was very common before the MMR vaccine was developed. The infection often causes no symptoms, but when it does, the classic sign is swollen glands between the ear and jaw. This creates the appearance of hamster cheeks. Despite high vaccination rates, there are still cases, usually amongst unvaccinated teenagers and young adults. Rubella, or German measles. Rubella, also called German measles, is a mild virus that usually causes no serious problems other than a fever and a rash. However, it can harm the unborn baby if a pregnant woman becomes infected. The symptoms are a low-grade fever and a rash that spreads from the face to the rest of the body. The MMR childhood vaccination protects against measles, mumps, and rubella. Whooping cough. Whooping cough, caused by infection with Bordella pertussis bacteria, makes children cough so hard they run out of breath and inhale with a hoop. The infection is most severe in infants and may require hospital treatment. The medical term for the disease is pertussis, the P in the DTaP vaccine. Meningitis. Meningitis is an inflammation or infection of the tissue around the brain and the spinal cord. In older children, teenagers, and adults, the main symptoms are severe headache, vomiting, fever, and stiff neck. Young children may have flu-like symptoms, but viral meningitis is usually mild. Bacterial meningitis is more severe, with serious consequences if it's not treated quickly. The best way to prevent meningitis is by ensuring that all vaccinations are kept up to date. Sore throat. Most children get a sore throat now and then, usually due to a common cold virus. So how can you tell if it's caused by a more serious streptococcal or other infection? Sneezing or a runny nose point to a cold. Seek medical advice if a sore throat lasts more than a week, or if there's pain or difficulty swallowing, excessive drooling, a rash, or pus in the back of the throat or fever. Scarlet fever. Sometimes a rough pink-red rash accompanies a sore or strep throat. This is known as scarlet fever. The rash usually appears 12 to 48 hours after the fever and often begins on the chest and abdomen and spreads all over the body. It's sometimes accompanied by a strawberry-looking tongue. Without treatment, it can lead to rheumatic fever and, in rare cases, heart damage. Scarlet fever is rare in the UK because of the use of antibiotics for strep infections. Reyes syndrome. You probably know you should never give aspirin to children under 16 years of age, except on a doctor's advice. Reyes syndrome is the reason. This life-threatening condition may affect children who take medication containing aspirin during a viral illness. Symptoms include dramatic behavioral changes, seizures, and coma. Reyes syndrome has become very rare since the aspirin health warnings were issued in the 1980s. MRSA, or MRSA. MRSA is known as a superbug because it doesn't respond to some antibiotics. MRSA can cause skin infections, such as boils and abscesses. MRSA infections usually develop in people being treated in hospital, especially intensive care units and surgical wards. Impetigo. Impetigo is another bacterial skin infection. It most commonly causes clusters of tiny blisters on the skin that ooze and form a golden crust. Touching the fluid can spread the infection to other parts of the body or other people. It's often caused by staph bacteria, but can also be caused by strep bacteria. Impetigo is most common in children because of close contact in schools and nurseries. If treated with antibiotics, the sores usually heal without leaving any scars. Ringworm. Yet another skin infection. Ringworm is actually caused by a fungus. No worms involved. It causes a red, scaly ring on the skin, or a round patch of hair loss on the scalp. The fungus spreads easily from child to child, so sharing combs, brushes, towels, and clothes should be avoided. Ringworm is treated with antifungal medication. Lyme disease. The hallmark of Lyme disease is a target-shaped rash that appears around 1 to 2 weeks after a tick bite, though not everybody will develop the distinctive bullseye rash. The rash may be accompanied by a fever, chills, and body aches. Lyme disease is not common. There are around 1 to 2,000 cases of Lyme disease in the UK each year, with the infected ticks commonly found in woodland and heartland areas. Without treatment, Lyme disease can affect the joints, nervous system, and heart. Flu, or influenza. Is it a cold or is it flu? These illnesses can have similar symptoms. The flu more commonly causes high fever, chills, body aches, extreme fatigue, nausea, or vomiting. Whilst most children get better on their own, the flu can lead to serious complications like pneumonia, especially in younger children. Flu jabs are currently only recommended for children in at-risk groups. Seasonal allergies. Seasonal allergies, like hay fever, are not an infection, but a reaction to microscopic particles like pollen, seen here in pink. Symptoms may include sneezing, watery eyes, and a runny or stuffy nose, and may only occur in spring or autumn. There is no cure for hay fever, but there are ways to help control the symptoms. This presentation was brought to you by the Parenting Advice channel.
Okay, so I do think that flu vaccine is on the schedule of vaccines for children, if I'm not mistaken. As you probably could tell, that was done for the UK, not the US, and so some of the information wasn't exactly applicable, but that was really the one thing that I picked up on. So I think we talked about most of those. So that's the end of the PowerPoint for today. As usual, I want to ask, you know, do you have any questions? Are you having any trouble? Did you do anything new and fun and different this week that you want to share with us? Anything? Brittany did her first pediatric venipuncture about a week ago. How'd that go? Did you get it in the first stick? Not bad. It's not bad. And they're kind of wiggly too, aren't they? So it's not just the veins, but the kid. So it's kind of difficult. Oh, Eldon, I'm sorry. Yeah, yeah, it's tough. We got called in for a code last night. Unfortunately, by the time we all assembled, the patient had expired. Yeah, those are the hard times. I've been there, done that. And it's really hard especially when you know everybody in town. Brandy, we are getting ready to have a back-to-school health fair today at 1 that has been organized by Katrina. So we will be having walk-ins for sport physicals, and kids are able to catch up on immunizations. Cool. That's awesome. Antonia, I get to be Izzy, the immunization dog. I love it. That is so awesome. That is, oh, how cool is that? So where are you guys from? Where?
Annette.
Oh, Annette Island? Cool. Let's see. Oh, Metlakatla. Okay. Okay, Leanna. Well, your time's coming. Don't despair. There'll be new and interesting things. So how's MindTap working for everyone? So next week we'll be doing chapter 27, so we're moving right along. Brandy, good, other than it's timing out when I try to do my work between rooming patients. Yeah, that's, yeah. And helping the providers. Be sure you save in between. I hope you're not losing work that you've done. Eldon is going. Just the last few weeks have been very busy for us, but we are managing. I have noticed that sometimes the answer in the book is not the right answer in the questions. Does MindTap set up the questions, or do you? No, it is MindTap. And so when you find those errors, could you send them to Rosaline? So that we can let MindTap know so that they can fix them. So, and then also we can give you credit for it in your homework, although it's just a pass-fail. So, but this is the first I've heard of that being an issue. So be sure you let us know whenever that you're having any issues with anything. Because this is our first time through, so we don't know what we don't know. And so, okay, thanks, Leanna. That'd be great. I know it's a little bit extra, but it'll help the next group. So that'd be great. So yeah, anything we can do, anything that's not going the way that you would like it to go, let us know. You can email Rosaline. I'm gonna put her email in here. Right, Rosaline? Okay, so that's Rosaline's email in there. So any issues at all that you have, please email her, and she'll take care of it, or she'll find someone who can take care of it. Okay. All right, well, we'll see you next Wednesday, if there's nothing else. So I'll just wait for a minute and see if anybody puts anything else up. Bye, Eldon.